Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And today we're going to hit a part of this disc topic that I think most people would want to know, which is if I've got degenerative discs, how do we slow the process down? Because degeneration in and of itself implies that it's a process. It's a wear and tear process, and wear and tear doesn't get better by doing nothing. However, there are things that you can do to slow it down. And depending on the degree of it, and depending on the amount of care that you put into it, you might even be able to stop it. So the degenerative disc, like I said, as the name implies, it is associated with wear and tear over time. Disc degeneration occurs when the shock-absorbing properties of the disc starts to deteriorate. Spinal discs provide a cushion effect between two vertebrae and the space where the spinal nerves come out. And this is a good point for everybody to understand, is that you were designed with a hole that is created when two bones of the spine come together, and the disc creates that space. And when that disc deteriorates over time and gets thinner, that hole gets smaller, and there's no room for that hole to actually get smaller, and you're going to end up with nerve irritation on there. Whether you feel it or you don't, it'll actually be happening. Degenerative disc disease can certainly lead to arthritis. That's the common medical term for that, typically called osteoarthritis of the spine. They're essentially the same thing, but also other health issues like spinal stenosis can happen as well. That's a narrowing of the holes of the spine where the nerves come out the side, but it also can be narrowing of the canal where the spinal cord is as well. It's technically possible to slow this degeneration process down. Most people at some point in their life may experience a few changes in their spine, which may be signs of degenerative disc disease. Now, how do you slow it down? Well, there's several things you can do. One is live an active lifestyle. One very significant thing you can do, which helps tremendously in slowing down the disc degeneration process, is living that active lifestyle. One way to live an active lifestyle is to carry out a routine of exercises. Most chiropractors are going to advise their patients to engage in stretching or some sort of movement exercise. Those stretching or movement exercises allow you to move your joints through several different various range of motion, but importantly, we want to go through a full range of motion in those joints daily. Stretching exercises also help improve muscle strength, especially around the back and the abdomen. It would be best if you avoided over-reliance on your spine doing heavy work, and what that means is that if the muscles around the spine are deconditioned, then when you do lifts, your ligaments, tendons, and discs are having to take the load, where you could offset that by having a stronger muscles around that area. And the stronger muscles don't necessarily prevent you from developing degenerative disc disease, but they certainly help you with the lift when you're doing it, and take some pressure take some pressure off your spine. Also, look to maintain good posture, even when you're sitting at the computer. Taking little walks to flex your muscles after sitting for several hours, super important. We tell people to do that all the time. And then we tell people about other lifestyle things they can do to actually slow down disc problems. Quitting smoking is another one. Research has shown that smoking is an underlying cause for disc degeneration. Tobacco smoking affects spinal discs in numerous ways. Smoking is said to inhibit the rebuilding activities that occur around spinal disc edges. And if you are smoking, just understand we're not judging you and why you do it or any sort of things like that. But that doesn't take away the fact that negative things happen, to the body when you smoke. Smoking is also said to aid in the constriction of blood vessels that are supposed to provide nutrients to the spinal discs. Smoking may also worsen the symptoms of back pain through, though a lot of research is still ongoing in that. It is a generally held belief that smoking increases also the perception of pain. Another thing to do, watch your weight. Studies have shown that excess weight is said to be one of the root causes of a degenerative disc. I'm going to disagree with that. However, the one thing I can tell you is your weight will exert more pressure on the spinal discs based on how well aligned the spine is, what the posture looks like. But excessive weight and obesity certainly can increase the risk of disc degeneration, especially in the lower part of the back, because that's where all of the upper body weight sits during the day. That's why it's so important that you have proper curvatures in the spine from the side. And yes, you should have curves in the spine from the side. But when you look at the spine straight on, it should be straight up and down. You want to also be conscious of your nutrition. Be mindful of the types of foods that you eat, that you're getting vitamin-rich foods and avoiding, a lot of processed foods. Foods that contain healthy fats, vegetables, fruits. Ensure that you stay hydrated, because all those things improve blood circulation and the flow of nutrients to different parts of your body, including the spine, and all parts of your body require certain nutrients. See, disc degeneration is associated with wear and tear over time, but you can slow it down by living that healthy lifestyle, quitting certain bad habits, and avoiding a sedentary lifestyle. You could do things like yoga for movement, spinal reconditioning therapy, which we do in our office, other stretching exercises and movement therapy that we do to help strengthen the muscles around the spine. But you just have to also be mindful of the types of foods that you eat, because if you're eating a diet that's pro-inflammatory and you're just creating inflammation over and over and over again, especially in these areas of the disc, it's just going to create more wear and tear. I get that these are maybe a lot of things that a person would need to do, but once you get yourself into a crisis, understand that there's going to be more things that you're going to need to do to be able to get out of that crisis than you would once you get out of it. So I hope this was super helpful for you guys. This is Dr. Jason Jones. I want you guys to have a healthy week. Implement some of these things. Reach out to us if you need to for any clarification on it. Happy to help you in any way we can. God bless and have a great week. Bye-bye.